Upper back mobility, probably one of the most valuable things that you can spend time working on. Affects your mobility, affects your core, affects your posture, digestion, viscera. It's one of the 4 major centers of rotation in your body, so movement is not going to feel good if you don't have rotation. You'll have compensations from your big toe to the top of your head, so worthy of spending some time on. These are 5 of my basics. Starting with segmentations, so important for just linear capacities, get workspace in the joints and sensory input to wake up that area. Then decompress, and we do that through a lat stretch. Then spinal rotation, segmentally, but we go contralateral, then we go ipsilateral. And lastly, a CARS, controlled articular rotations routine, to touch on linear and rotational capacities of your upper back. And the idea is I want you to engage your core, keep those ribs down in the front, anchored down with your core, and then just see at that level where you have the edge of the block or the roller, I want you to try to extend. So make sure you're not letting the ribs pop. Those stay down, and you are simply getting a segmental extension at one of those stiff spots. Setting up, anchor your ribs down, keep that tension in your abs. Elbows are closer together than your hands, and rocking back. Decompressing your spine, targeting your lats. You can do the same thing on a bench. Just make sure abs anchor those ribs to your pelvis, elbows a little closer together than your hands, and rocking back. Breathe into anything that's tight. Reach through, spinal twist. Breathing into that left back body, expand. And when you breathe out, see if you can find some more motion, reaching through. Roller or block underneath that knee, and then the challenge is, can you maintain contact of your hand on the floor as you draw the biggest circle as is possible all the way around? Back and forth, and then compare to the other side. And if you find asymmetry, trying to bridge the gap between those two sides. Torso CARS, segmentally flexing down all the way. Rotation, side bending, extension, tall through midline, up and over, side bending, rotation, flexing down, and reverse. Rotate, side bend, extension, tall through midline, side bending, rotation, and then do stop if you feel something tight and breathe into it. Get big, expand, and then keep going.